I hope you can join us for another episode of our new show, DaBootyDoc Talk.
Hello, good evening, guys. This is Dr. Shiraz Farooq, the Booty Doc. I will be talking with Sydney Farooq, who's my spouse and my partner. We are here talking about everything today. We're talking about everything, which is hemorrhoids.
Well, in some people's worlds, but it's a very common ailment of the rear that people deal with. So if you have questions about hemorrhoids or you know someone who might be interested in this conversation, get them on board.
We are live at the Colwell practice in Tampa, Florida, talking about hemorrhoids. Today, the Booty Doc Talk.
Yes. So if you missed us last week, it was our first episode. We talked about constipation. You can check out all the streaming episodes afterwards too. So today, hemorrhoids is our discussion. We're doing this to educate. We want to help people open conversations that are uncomfortable. Who else are you going to talk to about, right? The Booty Doc.
The Booty Doc is here to talk and entertain you. The entertainment value of this show is there for you to smile and laugh and maybe get some education. I'm a physician, so I will be talking in some medical terms, but don't think of this as medical advice. You have your own doctor who can help you get better answers than I can. I'm not the world's best expert, but I am an expert at some of these things. The Booty Doc is here to talk and make you laugh sometimes.
Yeah, so we take a lighthearted approach on colorectal problems, basically. So you got to have a frank conversation from time to time about what's going down there. But we know how to make you smile when we're doing this too. So,
and we know that we talk about the pain in the butt or the pain in the rear a lot, and people get all worried about it, and it does hurt. Having a hemorrhoidal problem can hurt a lot of people, and there are so many people who need help.
Now, are there other names for hemorrhoids, or what is a hemorrhoid exactly? Before becoming a proctologist wife, I gotta admit, I didn't know much about this.
Hemorrhoids can be called speed bumps sometimes, or asteroids in NASA's world, but in the reality, hemorrhoids are also known as piles. The hemorrhoids can be things that come out, and a lot of times people don't know what they are. They come from your behind, and they can do all kinds of stuff. So, people have different names for them, and hemorrhoids are spelled with HEMORRHOIDS. So there's double R in it, and a lot of people spell it with two N's. So it becomes a hemorrhoid.
And hemorrhoid, what's that referencing to here?
HEMO?
Hemorrhage?
Oh, hemorrhage, yeah. So the hemorrhoids they bleed. And that's what causes a lot of panic when that happens. You see blood in the toilet, in between your legs, and you freak out. And that's when you go into a rage, and that becomes hemorrhoids.
More than that.
Probably. I'm just making it up as I go.
So essentially what a hemorrhoid is a blood vessel in your anus that is bleeding because it's becoming so inflamed, irritated, enlarged.
So hemorrhoids are blood vessels that we all have inside our anal region, and that area can become abnormal, and the blood vessels in that area can sometimes get swollen, angry. This happens when you apply pressure, and that causes the hemorrhoidal blood vessels to become backed up, and that's where you get pressure and irritation and pain, and sometimes bleeding also. And then you have the roids.
So when we're talking about bleeding, is there different types of bleeding to look out for? Am I going to see a lot of blood? What's a drop of blood look like in a toilet versus my whole bottom's falling out?
So for some people that can be a lot. Blood in the toilet bowl can dilute and can make the whole flush become red, and it can be blood clots, or it can be just when you wipe. So there are different I would say different types of signals that can happen. But hemorrhoids, we divide them into internal hemorrhoids and external hemorrhoids. External hemorrhoids are the ones that you can see on the outside, and internal hemorrhoids are the ones that are on the inside.
I see. So either could be bleeding, and you might get different types of bleeding depending on what kind of hemorrhoids you have.
Probably. Most of the time, the bleeding is coming from internal hemorrhoids and not external hemorrhoids. Internal hemorrhoids are the blood vessels that are on the inside. External hemorrhoids can bleed when they become thrombosed. And you might have heard this word a lot, thrombosed hemorrhoids, which means that the hemorrhoids are swollen, angry on the outside. They look like purple marbles or blood vessels, and they are very painful to touch, and they get swollen and cause discomfort. And when those hemorrhoids pop or they open up, then the blood comes out, and that's when they start to bleed.
So you might not have external hemorrhoids, you might notice bleeding. That could be an indicator of internal hemorrhoids, which are more likely to bleed.
Correct.
External hemorrhoids are, when they're bleeding, typically it's because maybe they're thrombosed, which means they're basically blood clotting, about to explode.
Correct. And the bleeding actually happens when they burst open or they explode. I wouldn't say explode, but yeah, pop open and you're like, boom.
So, and thrombosed hemorrhoids can be very minor. They can be very extreme to golf ball size or more. So that's why it's important to know about these things, because you might have a little pain in the butt, maybe don't do enough investigating on your own, and next thing you know, you can barely walk, sit, or stand, and you're showing up at our office or the ER even if we're not available. So it's important to kind of examine yourself if you're feeling pain or noticing blood.
And that's where the hard part is. There are parts of the body that you can examine yourself, and the bottom is one of these areas where it's really difficult to look down under. You have to become a kangaroo or flip over or have a camera or a mirror and try to look that way. It's a better options available, but it's still very difficult to look down there. It is a mysterious area, and a lot of doctors know about this, so you really have to seek attention from a medical professional to help you with this issue.
And even, we're a specialty practice, so Dr. Farouk's a colorectal surgeon in particular, so a lot of physicians, like your primary care, or maybe even if you went to urgent care, a little ER clinic, they might not be able to actually treat your condition. They can diagnose it, but in a lot of cases, your best bet is going straight to a specialist if you're thinking you have these issues.
Do seek attention, though. That's one thing I would like to point out, that don't let this go. These are issues that should be addressed by a medical professional. So if you feel like you're having swelling, if you're having pain, if you're having bleeding, then pull that emergency button and call a doctor or call a provider.
Don't Google things, because everyone's different. So the picture of what you see online is not necessarily going to apply, and you're going to get yourself all kinds of worried. We deal with, tons of fear. So don't avoid making an appointment or calling a professional just because you're afraid.
True.
Actually, people call us all the time. We're like, we know what you're dealing with. We're happy to help. And they feel so relieved. It's like, why did I wait years to make this phone call? So definitely, if you can't examine yourself, or you have maybe a partner who can't help you, then find out. Don't wait. Especially hemorrhoids are common in women because of childbirth. So
yes, well, hemorrhoids can be due to many different conditions, and they happen to almost everybody. There's about 4 to 5 million people in America at some point, at one point, that have hemorrhoid issues.
At any given time.
Any given time.
Yeah.
So we
they
know.
say 1 in 4. I bet it's more.
No, it's a lot of people have hemorrhoidal issues, and our job is to find them and help them. And this is a way to talk about it in a casual manner and say, you've got roids, you've got solutions.
So what types of things cause hemorrhoids then?
So before we go into that, some of the symptoms that I talked about, include burning. You can have itching also in that area. You can have some discharge sometimes. You can have extra skin in that area that can cause problems. Sometimes you'll have pain, and sometimes you can have bleeding. Very infrequently do you have other symptoms. And sometimes you can have other problems that mimic as hemorrhoids. So that's also another reason to seek medical help.
Interesting, true. So, like rectal bleeding, maybe you have some blood on the toilet paper. It might be because you have a cut on your anus, not because you have a hemorrhoid. So, finding out about those things, don't assume what you have. That makes an ass out of you and me, right?
Well, the funny part is that the British say ass is A-R-C-E, arse, and the Americans call it ASS. So it's a little bit of a difference in the language across the Atlantic Ocean, but it is there.
You might not speak the same proctology terms then.
Right. I mean, like, there are universal terms, blood in the bottom, you're like, oh my God, I have some problem there. So
It is very serious. You don't want to wait because you need to have an answer, whether it's you got cancer, which everyone's afraid of hearing, or it could be something really simple. And then you're like, why was I waiting 3 years to come and find out after I had a baby?
So when talking about hemorrhoids, we talk about how you're going to find out you have hemorrhoids. So number one, you will have to perhaps Google it. I was listening to you when you're talking about Googling, and I was like, we all Google, okay? But after Googling, maybe go and do some chat GPT. That's new, okay, guys? There is AI that's not able to help, but use your brains and go seek medical help because that is what you really need. And why am I saying this? In my experience, I have come across many, many individuals who have waited too long. And it's always like a bummer, and you're like not happy about it and say, guys, why didn't you come to me earlier? And they are all afraid because it hurts. So they are afraid that when a doctor examines you, when they have to do something, the pain of that is going to be worse than the problem they have. And that's what is the handicap, which I think scares a lot of our people. Maybe it's the boogeyman, but the Booty Doc is here to help you guys.
And not make you run away.
Correct.
Well, so if you get diagnosed with hemorrhoids, then you have treatment. So that's kind of what you're talking about, what type of treatments and what to expect. So you're not as apprehensive about making a visit because you are afraid of what's going to happen when you walk into the door.
Well, as you're diagnosing the patient, they're in your office, you're going to be undergoing a physical examination. That's part of something that everybody is scared of, and that's where the proctologist is going to do what's called a digital rectal exam with his fingers. Basically, you look around and you feel for the hemorrhoid, after which you may need to do an exam with a lighted anoscope, which is a small tube that can look inside the anus, just like when you go to a doctor and you have to open your mouth and say, ah, and you look inside your mouth.
So these are in-office procedures, not requiring you to make a separate appointment or use any special equipment, no anesthesia or anything. It's just your consultation and exam.
And then you may be required to undergo further testing. Sometimes you undergo what's called a flexible sigmoidoscopy or colonoscopy. These are tubes that can be put in with a camera, and you can look around and see what's happening. But afterwards, when all of this is done, the next part is how do you treat somebody with hemorrhoids? And that is something where you may ask your family member, your grandma, your parents, your mother, your dad, and sometimes, and a lot of times, patients and people start using over-the-counter remedies and creams and salves and other things. So we try to tell people that there's a way to go about it. The first thing we want you to do is soothe the pain. Okay, if there's blood on the hemorrhoid, wipe it, keep the area clean. If there's a lot of swelling, you can put ice pack on it. You can apply some heat to the area and alternate between that. Running water can clean some of the mess that's in that area, and then rest, and then drink some water because hydration is very important, as well as eating more fiber. So fiber will help with constipation, which will help with decreasing swelling. So all of that will make a difference.
Fiber also helps make sure your stool is the right consistency, so it's not too hard or in maybe like little pebbles that might agitate or irritate your hemorrhoids too on the way out. So,
Correct.
So proper diet means that your poop is good. And if your poop's good, it's not going to irritate your body as much. It's going to do the things it should be doing.
To poop or not to poop? Isn't that the question to ask everyone?
Hey, if you're just joining us too, I know a couple of people hopped on there. So just to reiterate, we're talking about hemorrhoids today.
And I hope all of you guys can hear us. We got these fancy mics and we're trying to see if anybody can hear us. And
hello out there.
Hello.
Do you need to talk like this or like this?
DaBootyDoc is here with Sydney Farouk. And some of the things that we're talking about is how do you take care of these hemorrhoids. And topical creams can be used. There are balms, there are solutions that have been around forever.
Really work? I hear patients all the time say, I've been using this cream, it didn't do anything.
Let's go back in time and ask Aristotle. Do you know that Aristotle used to take care of hemorrhoids? Hemorrhoids are one of the oldest things for which we used to do incision and drainage. So when scalpels were around at barbers and hemorrhoids were cut open, you were able to drain hemorrhoids and take care of people like that.
So you get your hair cut and your hemorrhoids drained on the same day.
Yes, this is very true. Okay, guys.
I can cut hair, so anyone that wants to try it out here, let me know.
So from 2,000 years and beyond to now, we have used a lot of plant-based medicines, salves, creams, and people have almost put anything on top and anything in the bottom. And people have tried a lot of treatments.
There are suppositories.
Yes. The goal of the treatment is to decrease blood flow, okay, and decrease swelling and inflammation, which means that it improves your pain and soothes you. So if you can do all of these things, then you can make a difference. And that's why I was mentioning different modalities, okay? Ice, heat, and treatment with creams and salves and balms to decrease the blood flow and swelling and inflammation, and also adding foods and diet to cause less constipation.
What about hemorrhoids and CBD or medical cannabis?
Oh, now you're talking about something very, very different. And people have used medicinal marijuana salves and creams in different parts of the world for their hemorrhoids. The FDA does not approve that. And it is difficult for me to comment on a topic like that.
Fair enough, but you can look into your own options. So there are plant-based salves and
solutions
topicals
out there.
too.
Yes.
Yeah.
So the other thing, after you've done your home work, which I call taking care of your hemorrhoid at home, you have still noticed a swelling in that area, which is painful. You wake up with a swelling and you're like, oh my God, what happened to my bottom? There's a grape size or a golf ball size swelling. So you call 911 or you call DaBootyDoc. Okay, you call a physician and or a provider or somebody who has expertise. And the goal is to get to them as soon as possible. Because the sooner you seek medical advice, the better your chances of getting it treated appropriately.
Very true. So like he was mentioning when we talk about thrombosed hemorrhoids, when it's an external hemorrhoid that's bleeding because it's blood clotting, it's maybe leaking or burst open. So that is an emergent type situation. You don't need to go to the hospital, but you need to treat it effectively and quickly because at that point you're in an extremely painful state. You're not going to heal very quickly. So you need some sort of intervention.
True. Hemorrhoids, when they are painful, outside hemorrhoids, external hemorrhoids, they are thrombosed. And thrombosed hemorrhoids, unless you relieve the pressure, they're going to continue. So your job is to seek medical help. You go to a physician, emergency room, urgent care, a proctology service, a gastroenterology service, a primary care doctor. There's a bunch of doctors and physicians out there who are trained to lance and incise a hemorrhoid and remove the blood clot. Once the blood clot is removed, then the swelling goes away, then the bleeding goes away, and the pain goes away. So
basically instantaneous. So it doesn't heal you, but you get
it
that
relieves the pressure.
relief. Yeah.
After that, you can apply a cream and swelling will go down with it, or you can apply an aseptic or antiseptic medicine to calm the area down. Soak in water, use ice, eat better food.
Very important. I try to let, especially our women patients, know this because I know you all have a million different creams at home. Don't put anything on it other than something that's water or given by the doctor. No perfume scents. That you don't want any chemicals, especially if you get a suture or something. It might actually break down the suture. It might keep the area from healing. So you're tempted to put a bunch of goop on it, but it might actually be problematic to your process of healing.
So when we talk about all of these issues, and I get a lot of questions from people all the time, how to help hemorrhoids. We also talk about why all of this happened. So we want to know, is this your diet? Is it your posture? Is it your age? Is it your condition that caused all of this? And all of that can be contributing to it. So pregnancy is one of the common things that we see in females, like you mentioned. They can get hemorrhoidal issues during their pregnancy for a number of reasons. They have a baby that's pushing pressure in that area. They have bowels that don't move as well. They don't eat lots of fiber, so they get constipated. And that can all cause issues. Workers who are doing heavy lifting, standing, truck drivers who are sitting for a long time, policemen that are walking around with heavy belts, and teachers who have to teach and standing up. So all of those things, prolonged sitting and standing, can aggravate that. If you're not adequately hydrated, and if you're not eating too much food, and you're not having fiber, you will have hemorrhoidal problems because you have to push a lot. Also, do you know that diarrhea can cause hemorrhoids too? Which is interesting. A lot of people don't understand that, but runny liquids or going to the bathroom a lot of times, again, is an act where you're applying pressure and force.
So the root cause of all these things you listed is that your pelvic floor, your rectal area, you can't apply pressure to it all day in the same way. That's why you're not supposed to take your phone on the toilet. You shouldn't be sitting there for 30 minutes. Think about how much pressure is going on that little pot. So you're not supposed to have prolonged pressure or
and prolonged sitting on the toilet. For that, there is a device that is available now. It's called the squatty potty, where you keep your feet up on the toilet. That
above your head, it's crazy. No, I'm just kidding. It's not like that.
But it makes you sit down like a normal.
It's a toilet stool, which you've probably seen at your friend's house.
And what that does is two things. Number one, it changes the angle so the poop comes out easier. But what I find interesting is that it also gets you off the pot much faster, because you're on the toilet in a very uncomfortable situation. So you don't want to stay there too long. So you're going to be like, okay, I can Google and Instagram and TikTok afterwards. Let me do my business and get off.
Yeah, don't start that habit. It really isn't bad for you. That's also something he didn't mention is younger people who do weightlifting or
weightlifters.
Again, that's a lot of pressure. You're trying to pump above your head. You have all that going down into your bottom area.
When I did CrossFit, and I did it for a while, I had the calluses and all that. We were doing deadlifts. So deadlifts and doing heavy lifting where you use a lot of your abdominal chest pressure and intra-abdominal pressure going down. You do the Valsalva maneuver, which is blowing air all the way down, and that causes the pressure to go down, and it can cause those blood vessels to get swollen or pop, and that is a hemorrhoid.
Right. So
and a problem.
Your lifestyle, I kind of preach this for so many different things, but it applies to our health, physical, mental health. You got to learn, and from a young age, the right things to eat. Why do you eat fiber? Because it does good things for your body, especially concerning your poop. Why is it good to have good poop? Because your body as a physical entity can only handle so many things. You don't want to be putting extra stress on it or doing things that are going to cause potentially other issues. And then if you realize you do have an issue, you know how to resolve it. So you need to be drinking water, you need to be exercising that pelvic floor area of your body, you need to be taking adequate foods to have good stool, you need to make sure you're not putting too much pressure on your body. Why take up weightlifting or why become a cyclist and cycle for
Oh yes,
500
the
miles a
cyclist
day?
too, I wanted to say.
So-
For people who sit down for a long time, we also see hemorrhoids in people who bike for long periods of time also. So
Yeah.
again, it's a postural problem. It's a
Educate
pressure
yourself and then educate someone you know too. If you've been in our office, hopefully you've told somebody about your experience and maybe you've recommended.
problem. A lot of people are shy to talk about this.
But that's
you know.
my
That's,
point, is
That's
that
why we're here, because
open the conversation, because it's going to help someone you know. The people that leave Google reviews and share their experience, it helps someone else who's searching too. So do your part to educate yourself and then teach your children. We told our 18-year-old daughter a little lesson about hemorrhoids and she was like, oh, I never knew, because she's weightlifting in school. She's like,
well,
oh, I better
a
be
lot of
careful.
time in schools and colleges, we are not taught about the human body in a functional manner. So if you're able to tell them that, look, posture is important, exercise is important, but don't overdo it. Diet is way important. Hydration is so important. If you try to do that, then you can improve on a lot of problems that people have, and prevention is better than the cure. So if you want to prevent hemorrhoids, if you want to improve your life, then add more fiber. Sprinkle some flaxseed powder or psyllium husk or something else on your food. Eat fruits, vegetables, lentils, legumes. Eat the rainbow, okay? And that will allow your digestive system to heal and function well. And hemorrhoids,
Yeah.
on the other end, are an indication that the other end, which is the mouth, that's feeding this gut all the way, is not doing its job properly. So
the problem starts here.
well,
You are what you eat.
Probably starts up here, I think. We think about what we're eating and then we put it in our mouth, and then it does its own journey and comes out the other way.
Yeah.
And in that journey, if we don't take care of ourselves, then we end up having hemorrhoids or hemorrhoids or roids.
Got roids.
Got roids, got solutions.
We have solutions. Well, we're almost done here today, so 30 minutes goes by quick. We want to address all of your questions. Reach out to us on our social media. Check out the episode, share it with your friends. If you don't want to talk about your poop, we'll do it for you. So
The Booty Doc is here to talk about hemorrhoids and give you some basic information as to what you should do about a part of your body that you may not know a lot. Okay, and hemorrhoids are something that we may revisit in our weekly talk, and I'm sure that I'm going to get a lot of questions. A lot of people will be asking us, because we see that every day. People are like, what?
Can we send pictures?
No,
Just
we don't
kidding.
do that.
I know someone's thinking it out there. You got to come in for a visit for that.
Yes, well, this is an area where you really need to seek a medical expertise, and it's a good idea to talk to your primary care doctor or your nurse or your provider and seek help, because that will make
You're
a difference in your life.
And keep in mind, Dr. Fruit is a professional. He's been doing this for almost 25 years. He's been training since he was 18 years old, but we can't give you the answers. You have to help yourself. So, don't take our word for it, but we're here to guide you and give you that information.
Final word. If you could give them one advice for the hemorrhoids, what would it be? Eat more fiber. Okay, guys?
I was going to say, don't Google it. But eat more fiber.
Well,
that works too.
Google it. I'm torn about it, because I've Googled a lot of things.
Don't Google it too much. What
okay?
I mean is, don't Google obsessively. Googling is to give you an idea to confirm that, yeah, you should go to a doctor.
But you should eat more fiber.
But
I really think that's
the overarching message is that when you change things, like the solutions we're giving you for hemorrhoids are the solutions for a lot of other things.
Correct.
So incorporating exercise, eating right, doing all those things,
and hydration. All of this is so important for you, and that's why we try to keep it very simple. This is not supposed to replace or be a way for you to get medical advice, but just medical information. Slightly better than Google, I think. What do you think?
Google us. We're going to start our own AI service, I think, and you'll be the back end of it, pumping in all the information for everybody.
Well, I don't know if I can do that. I think there are smarter people doing that. But anyways, guys, we are done. Thank you so much. Have a wonderful day. DaBootyDoc and Sydney are going to be off now. Thank you.
Check us out. Keep an eye on our social. We'll post our topic for next week. So if you want to tune in, you know, ahead of time, you can ask a question if you want. We can feature you on the show. So let us know how we can make you happy.
Thank you very much, guys. Have a wonderful evening and enjoy your food and sprinkle some fiber.
Ooh, yay.
Thank you.
Let's eat.
Take care. Thank you, guys.
Good night.
Bye-bye. Good night.